Hi, my name is Jessica and this is my colostomy care skills video. First I would gather my supplies. So I grab my colostomy bag, my plate, my washcloths, my ostomy paste. I have hand sanitizer in my room. I grab my plate and my trash can would already be in my room. So first I would knock on my patient's door. I would shut my patient's door for privacy. I would then hand hygiene. I go in and introduce myself to my patient and say, hi, my name is Jessica. I'm here to do your colostomy care today. Can you tell me your name and date of birth? I would then verify the two identifiers on their wristband. Okay, great. I would get on my gloves. I would explain the procedure to my patient. Okay, Miss Smith, so today we're going to be here doing your colostomy care. I'm going to remove this bag and I'm going to remove your base plate. I will then clean your area. I'm going to assess your stoma. I'm going to assess your skin underneath the base plate. All right, and then I'm going to measure your stoma for your plate. I'm going to apply your plate, apply your bag, and then you'll be good to go. Okay, so I will begin here. All right, let me know if you have any discomfort or pain when I go ahead to remove this. All right, so I'm going to remove the bag here. All right, I'm going to remove it towards me, not towards them. All right, so if I was just removing my bag, I would throw this in the trash and just get a new one and apply it. All right, but since I only have one, we're going to take this to the bathroom and empty the contents into the toilet. Okay, so I would first notice if there was liquid stool in here. I noticed the consistency. If it was liquid stool, I would empty it into a cylinder and measure it. All right, so we're going to unclip the clip, unroll the bag, empty the contents into the toilet. All right, we would then roll the bag back up. Put the clip on. All right, since I only one, we're going to put this to the side. All right, Miss Smith, we are going to remove your base plate now, okay? Let me know if you have any pain. All right, again, going around. I'm going to lift it towards me. I would throw this in the trash, but since I have one, I'm going to set it to the side. All right, Miss Smith, I'm just going to take a look at your stoma here, okay? I'm going to assess the stoma. Make sure that the stoma should be beefy red and moist. If it was ash, purple, or a blue color, I would notify the provider. Okay, so I've assessed my area. I've also am going to assess the area of where the base plate was to assess the skin. All right, see if there's any redness. There's no redness. All right, Miss Smith, I'm now going to clean your stoma and around the area with some warm water. If the doctor prescribed any other solution, I would use that as well. Okay, so I'm going to clean the area here, Miss Smith, okay? All right, I'm cleaning the area. I would flip. I would also clean the stoma. If there's any stool, I would clean with a new area each time. Okay, gonna discard that. Okay, all right, Miss Smith, I'm gonna go ahead and measure your plate now. So I'm gonna grab my plate. I'm gonna one that's closest to it, but not too tight. So that's the 1 3/8. All right, I then get my base plate, measure, cut out. All right, Miss Smith, I'm just going to dry the area, okay? So I'm going to take my other washcloth and dry around in the stoma. All right, I'm going to discard that. All right, Miss Smith, I am going to now get the base paste and put it around your skin here. That way it'll adhere the plate a little bit better. All right, I would allow that to completely dry. All right, the area has completely dried. I can go ahead and put my base plate on. All right, got my plate on. It's not too tight. We're adhered to the skin. All right, Miss Smith, I'm going to apply your bag now, okay? All right, when applying this bag, I want to make sure that it is clipped down in place. All right, Miss Smith, when you're home and you're cleaning your stoma, make sure, you know, you have to be proactive in making sure that your stoma is nice and red. It's normal if there's a little bit bleeding whenever you clean it, so don't be alarmed about that. Okay, do you have any other questions for me for today? No? Okay, I'm going to give you your call bell. Are you comfortable? Okay, great. I'm then going to discard of my gloves. I would then hand sanitize. I would go out and document my colostomy care and my colostomy change. As I noted earlier, if my patient if the stoma was dry or if they had blue, purple, ash color to it, I would then notify the provider. All right, that is the end of my skills video.